Hi, I'm Shannon Zuber with Progeny, and today we're going to talk about Simplify, a unique way for people to access frozen donor eggs. Before we dive in, I just want to ask that you subscribe, like some videos, maybe share a video that you find helpful with someone else. Those kinds of things really help. Donor eggs are a really wonderful option for many who are on their family building journey. Those with age-related infertility, diminished ovarian reserve, same-sex male couples, and many others might find donor eggs to be their best, or in some cases, only option. But there's a lot to consider when acquiring donor eggs, and today we're going to learn about Simplify, which tries to eliminate some of the risk with their unique approach. To help us better understand Simplify, today we have some of the Simplify team: Dr. Lori Marshall, Dr. Julie Lamb, and Kallie Fleharty. Doctors Marshall and Lamb are reproductive endocrinologists at Pacific Northwest Fertility and co-founders of Simplify. And Kallie is an RN with an embryology background and serves as program coordinator at Simplify. Okay, so what makes Simplify different than your standard egg bank?
Traditionally, a donor egg bank has eggs in its bank, and you purchase, say, 6 eggs. And you have them transferred to your clinic, and you just hope that you get something from those eggs. But our patients who choose to do donor egg have often been through a lot, and they've had multiple failed cycles using their own eggs, and it's extremely risky and disappointing if they have nothing to show for the eggs they purchase. So we wanted to develop a way to offer frozen donor eggs in a more patient-centric way, where we took the risk instead of the patient, and we took the disappointments instead of the patient. So with Simplify, we have the male partner's sperm transferred to our clinic, and then we thaw whatever number of frozen eggs we need to guarantee either 2 blastocysts or 1 normal blastocyst. And this way, if for some reason we had to thaw 10 eggs to meet our goals, we were the ones who had to do that and had to pay for it, and not the patient. So it's much less stressful for the patient to work with Simplify than to work with a more traditional donor egg bank.
That's a pretty big deal. When acquiring frozen donor eggs, there's always a chance that none of them will go on to become healthy embryos. And usually when that happens, you're just out of luck and need to go ahead and purchase more donor eggs. As Dr. Marshall said, Simplify is a way to guarantee either 2 blastocysts or 1 normal blastocyst. Now, if you aren't very familiar with IVF, then what I said may have sounded a bit weird. What is a blastocyst, and what is a normal blastocyst? Well, simply put, a blastocyst is an embryo that has matured to day 5 or 6 of development. And when she said normal blastocysts, she was referring to the chromosomal makeup of the embryo. When embryos reach day 5 or 6, they can be tested for chromosomal abnormality. A chromosomally normal embryo is an embryo that can lead to a healthy baby. So with Simplify, you can choose to either acquire 2 blastocysts or 1 genetically tested normal embryo. Now, no conversation about donor eggs is complete without talking about the matching process. Here's Dr. Julie Lamb and Kallie Fleharty to share how Simplify approaches matching.
So patients are matched through the donor process through a kind of a donor liaison. Actually, Kallie runs that, and she's been my nurse for years, and she's also an embryologist, and she's one of a very smart team member, and talking to her is like a breath of fresh air, and you learn about the donors. There's like a super special secret website that you get a access code to. You can see pictures of the donor, you can read personal statements. You really find out the information that you need to know to really bond with your donor. And she helps facilitate that. Like if you're feeling stuck or overwhelmed, having a conversation with one of the Simplify team members is always just really reassuring and helpful. And patients really enjoy that kind of human interaction. This is a hard thing. It's not the way you are hoping to build your family, and having a little bit of a help along the way has been really wonderful for our patients, as it is for patients that come and use Simplify from other clinics.
We really do try and keep things very simple, just as our name kind of implies. We really focus on personalized matching and personalized care for all of our recipients. I'll be or one of our coordinators kind of help guide each patient throughout the process and are kind of always checking in at each different step to make sure that, you're well informed, your clinic that you're using is well informed, and that you have all the information, that you need to kind of be successful in your pregnancy journey.
Simplify is really making things simple for those who need frozen donor eggs. I want to thank the Simplify team for stopping by to help us get to know them today. And I want to thank you for watching. Remember, if you enjoy doctor-backed videos like the one you just watched here today, you should subscribe to our channel, and if you want even more resources, you can always find more at progeny.com. Thank you.